Ladies and gentlemen, thank you. Thank you for being here today with us. My name is Trent Staggs, and I'm the Mayor of Riverton City. I'm honored and privileged to be here today, especially with these individuals here behind me who have really done some incredible work in confronting and battling the opioid crisis that affects our nation and our state. We have with us Utah Attorney General Sean Reyes, Intermountain Riverton Administrator, Hospital Administrator Todd Newman, President and CEO of NarcX David Schiller, and DEA District Agent in Charge and Co-Chair of the Utah Opioid Task Force, Brian Besser. According to Salt Lake County, there were approximately 240 million pills prescribed over a recent 6-year period. That equates to almost 200 pills for every man, woman, and child in the county. As a consequence of such rampant supply, these drugs are far too often stockpiled, diverted, and otherwise used by individuals in ways that lead to addiction, destruction, and sadly, death. This tragedy has impacted and affected so many people. We know, and unfortunately, we have become all too familiar with their stories. Opioids have resulted in over 67,000 national drug-related deaths and close to 650 just in Utah in 2018. In Salt Lake County, between 2015 and 17, there were over 800 drug overdose deaths. Deaths from opioids now surpass deaths caused by motor vehicles and firearms. For many years, we've looked towards our national and our state leaders to find solutions to this crisis. And over the last few years, they've made great strides. Utah has moved from the 7th highest in terms of deaths, opioid-related deaths, now 21st. So no doubt we made some good progress. But I believe in order for us to truly tackle the issue and make a positive impact in the lives of Utahns that are so affected, every community must be engaged in combating the problems of stockpiling, diversion, and addiction. As Mayor of Riverton City, I can do something in this regard, and I'm no longer willing to make this someone else's problem. The social costs are just too high. I was recently approached by a company here in Utah called NarcX. When we met, they claimed that theirs was the only product that could immediately render opioids and other drugs in a non-retrievable state, and the only product that met the federal requirements for on-site destruction. This helps to eliminate the stockpiling and potential diversion that can come as a result. It also saves time for local law enforcement in trying to properly dispose of these medications, as the product is non-toxic and can simply be thrown in the dumpster once it's full. And with solutions that are even down to the individual size, citizens can also be engaged in the solution by destroying unused medications immediately in their own homes. Seeing the benefits of this solution for our community and recognizing the need for valued partnerships, I reached out to the Attorney General's Office, the Utah Opioid Task Force, and Intermountain Riverton Hospital. We share common goals to provide for the welfare of our communities and residents. For its part, Riverton City will be placing these kiosks that you see here at multiple locations, where residents can immediately destroy unused or excess medications. Our great community partner, Intermountain Riverton Hospital, will also be making available individual-sized bottles for our residents to destroy unused or excess medications at their own home. We will also be engaged in an educational effort throughout the city, describing the problem and letting everyone know how they can be part of the solution. Here in Riverton, we are committed to helping our state and our national leaders combat the opioid crisis. I'm proud to announce that Riverton City is the first municipality to work with the Attorney General's Office and the Utah Opioid Task Force in this manner. I'm hopeful that this will initiate a trend amongst other municipalities and other community partners to take strides to not just talk about the problem, but to also be part of the solution. We can do something, and we must all do do something to be part of the solution. I'd now like to have David Schiller, the CEO of NarcX, say a few words, and then he'll be followed by Todd Newbert, Riverton Hospital Administrator, then Brian Besser, the DEA District in charge, Agent in charge, and our Attorney General, Sean Reyes, will conclude.
Good morning. It's a tremendous honor to be here today with these gentlemen behind me who are leading the effort with NarcX, trying to do something that's never been done before. I spent 30 years with the United States Drug Enforcement Administration, DEA. And the last 10 years I was with DEA, I saw the epidemic a little bit different than everybody else. As one of the senior executives in DEA, I saw the addiction from the diversion and its ultimate death. And I said, when I retired after 30 years in August of 2017, I said, what can I do? Everybody said, what are you going to do to make a difference? You oversaw the program, you get the issues, what are you going to do? And I said, education. Like, this is all about education. Whether you're a hospital administrator, whether you're my neighbor, whether you're a friend, you don't know what you don't know. So we created NarcX. NarcX is the first, it's the only on-site method of destruction in the United States, in the world, that as soon as you put your unwanted pill, tablet, capsule, or liquid into the NarcX container, it immediately is non-divertible. The second you put it in, you couldn't go back in and take it out. And it's ultimately non-retrievable, which is the most important standard. Because with DEA, look at one thing. Can these drugs be taken back out of the solution, and could they be diverted, lead to addiction, and lead to death? So it's got to be 0.00 retrievability when you go back into a solution. Otherwise, the only other method would be incineration. The problem with incineration, to simply educate, is it's stockpiling, like the mayor said. When you stockpile pills, tablets, capsules, liquids, everybody knows where they're at. They're so easy to break into. There's thousands of open source reports that show from nurses to doctors to law enforcement officials breaking in to these stockpiles at houses, at take-back locations, at every place you could imagine. I mean, it's a common stat in DEA, and everybody here behind me can tell you that 80% of addicts freely will tell you that they became addicted to a prescription drug that was not prescribed for them, and they got it out of their house, a neighbor's house, a friend's house, or an open house for sale. An open house for sale. Houses that you're not even going in to buy, they're going to medicine cabinets because they know they can self-abuse. They can sell for $1 a milligram, oxycodone, oxycontin, hydrocodone, Percocet, Valium. One pill goes for up to $80 in Utah. The unfortunate reality is, while we're having this press conference and we're explaining NarcX and the tremendous talent that's behind me, somebody's going to die when we're up here in Utah. Several people are going to overdose and be brought back to life by first responders through Narcan or their life-saving measures. But that's something we can eliminate. Because the second that pill no longer is needed by the person it's prescribed for, that pill can be immediately non-retrievable, non-divertible, instantaneously. It can't be abused. It can't be diverted. You can't be addicted, and you can't die. That's the problem. So when the mayor said 64,000 people died last year, I would challenge to say it's much, much higher because we're not reporting the facts consistently throughout the United States. I would say, conservatively, another 640,000 people overdosed last year and were brought back to life. But people now are relying on Narcan, naloxone, they want to get that high. We're not talking about taking pills and medications away from those that they're prescribed for, that are in pain or discomfort, or have cancer, or have a devastating life issue. We're talking about pills that were not prescribed for somebody, they're being diverted, they just want to get a high. They have a bad day. Their kid lost the soccer game and they didn't play. It's as simple as that. So NarcX has a solution that has 3 independent validations, and you simply, I'll show you in a second, I brought one of my files, I had a different place of surgery, and now I'm ready to get rid of my tramadol. The bottom line is, we don't want it being diverted. We have 3 laboratories that prove what we say. It doesn't matter what this DEA guy used to say, it's what the evidence says, what the law says. So we have a criminal lab that shows it works on cocaine, heroin, methamphetamine, THC, CBD. We have a DEA registered analytical lab saying it works on opioids, instantaneously. And then we also have an environmental lab right here in Utah that says this stuff is environmentally friendly. You can put the NarcX when it's done being used in your local trash, or you can put it in a landfill. It's environmentally friendly. So I really appreciate the opportunity to be up here today. And it's as simple as this. This is a simple kiosk that we've had made for our law enforcement partners. You simply lift up the container lid, you take your vials. And the thing that's so important about these vials is nobody in America wants their private information leaked out. So they redacted and let us keep it. We made it simple. You take the pills, you pour it in, it goes instantaneously into a liquid solution. Our chemical engineer right now could not go in and take those pills back out. And if somebody tried to drink it and put their hands in there, they would throw up. There's zero abuse potential in it. It's gone. And then you take the vial back home and you get rid of it, and you don't have to worry about your information getting exposed to law enforcement or anybody else in the United States. It's as simple as that. That's why we created NarcX. Thank you for your time.
So Riverton Hospital is honored to partner with Mayor Staggs and with Riverton City in developing solutions for the opioid crisis. Intermountain's mission is to help people live the healthiest lives possible. Part of living the healthiest lives possible is using medications and ensuring that they're used as directed and as indicated. As part of taking an active role in our own health and in the health of those around us. Pain medication, if not used as intended and as directed, can lead to devastating outcomes to individuals, families, and communities. Did you know that 74% of Utahns currently addicted to opioids get them from a friend or a family member? Did you know that physical dependence on opioids can happen in just 7 days? For these reasons, Riverton Hospital is partnering with the city to distribute bottles of NarcX intended for individuals in the community who wish to be part of the solution. Those who wish to clean out their medicine cabinets, to eliminate the threat and potential devastating effects that unused narcotics pose to loved ones. We have 1,000 bottles and individual bottles of NarcX to distribute. And you can get yours at the Southridge Pharmacy inside Riverton Hospital. You can obtain a bottle of NarcX to neutralize your narcotics, or you can dispose of your medications and prescriptions in our safe drop box there. Before you accept a prescription for yourself, have the opioid talk with your doctor. Ask for safer alternatives to opioids. And if you have leftovers, remove them from your home. You can keep yourself and your family members safe. If you or a loved one are addicted to narcotics, their help is available. We'd just like to thank Mayor Staggs and the Riverton City for encouraging us all to be part of the solution to this national crisis.
Good morning. I also want to thank the Mayor, Chief Hudson, for thinking outside the box. I'm proud to be up here with my colleagues here. As a government guy, you guys know that government moves at the speed of peanut butter, right? It doesn't move very fast. We oftentimes don't get things done the way we need to. So I was literally taken back when we received a phone call from a city that wants to be progressive and actually be part of the solution. I was absolutely elated to be here, to be part of this, because it was such a proactive stance on such a grave issue. Let me just fly at just a little bit of a different altitude for just a second here. I just want to paint a picture. I promise my comments will be quick. Because Sean and I usually end up duplicating each other because we're kind of like rubber from another mother when it comes to this. So here's what's interesting. As I travel around the state, we live in an age where we have such rapid exchange of information. Kids nowadays have such a wide and broad exposure to just about any type of data they can get their hands on. So do we as adults. Why did I bring this up? Because when I travel around and I speak on the opioid epidemic, which right now this problem is ubiquitous, And I say to somebody that in 2016, we lost 64,000 Americans to drug-related overdoses, I sometimes get the proverbial shoulder shrug. I get the, why? Because we have become inoculated to statistics. We hear them all day long, all night long, we read them on our phone, and we forget that these are people. These are our neighbors, our spouses, our kids, our grandparents. It's the gentleman who's in the cubicle next to you at the office that you don't know is going through a problem. It's the dear lady across the street who brought you cookies last Sunday, and you have no idea she is quietly struggling in the prison of her own cycle of addiction. This is the problem. In 2017, those numbers went up to 72,300 Americans. The 2018 numbers are provisional. They're no better. I'm still waiting for a final estimate. We don't know where 2019 is going to take us. Sticking to my talking points, I was asked to elaborate a little bit on the state's efforts for this opioid epidemic. I've had the pleasure with DEA to travel around the country for the last 30 years. Dave and I were actually colleagues. Proud to stand next to him. And what is very interesting is out of all the states that I've had the pleasure of working in, Utah has been the most progressive, thinks outside the box, and I call Utah the solution state because we try to get things done. We try to cut through the red tape, I'm not saying we do it perfectly, and get things done. The inception of the Utah Opioid Task Force, which I'm proud to be a co-chair of, along with Attorney General Reyes and U.S. Senator Mike Lee, we are trying to come up with quick and innovative and active solutions to help address this problem real time. We want to cut through the bureaucracy. We want to have enough executive horsepower at the top to make these command decisions happen and be fluid and dynamic while we do it, because lives are at stake. You know, I was asked about the importance of education. As I travel around the country and this state, there is one comment that comes up to me every single time I speak. After I speak on the opioid epidemic, people come up to me and they say, "We had no idea." And it goes to my next point, which is the power of local solutions. The reason people don't know is because they don't view the problem as their problem. Until we grasp the opioid epidemic as not just an individual problem, it's Bill's problem across the street, right? It's what it always is. It's not my problem. Until this becomes a community problem, we're just treading water. If we had the same exposure up at the Capitol for the number of people say that we're dying with DUIs, firearm-related incidents, they would be picketing up at the Capitol for those type of deaths. But we are losing in between 50 Utahns a month to this, and I believe those numbers are very conservative, and it's quiet. We don't hear anything. So the solutions have to be local, they have to be efficacious, and they have to be real time. And each solution has to be unique to the geographic or demographic area. That's the truth. You know, the solution that we try to apply to Louisville, Kentucky, or Pittsburgh, Pennsylvania, maybe isn't the same type of solution we need to use here in the state of Utah. I'm proud to stand up here with these gentlemen. I'm proud to be participating in an event in Riverton. I'm proud that we have a proactive stance here. I hope that other municipalities follow suit. And again, I'm thankful for an innovative product like this, because this could be an absolute game changer for the risk and the issues that come up as we have to deal with literally the disposal of unwanted, unused, and expired prescription medication. Thank you.
I should just say a minute step back, because I can't say any better than what each professor or any of the other individuals said. I was given too some talking points and a boatload of statistics, but I want to throw all those away and just speak from the heart a little bit. Ladies and gentlemen, America is facing its most serious public health crisis in our nation's history. It is a threat like none that we've ever seen. It's a clear and present danger. And just out of curiosity, how many of you think that that you might have in your closet, in your restroom, at home, or in the kitchen somewhere, or even in your own room in a drawer, some unused, expired medications in a bottle. Go ahead, be honest, raise your hand. Thank you for being honest. And you're no different. Those hands go up everywhere around the state. Do you realize that you might be the biggest drug dealer in your neighborhood? Most people don't. But giving that access puts so many in danger of your loved ones, our loved ones, the people that we care about. Imagine, none of us, I hope, would put a loaded gun or loaded guns in the side table drawer in our bathroom cabinet, and yet that's what this represents. The possibility of hurting people that we love, that we care about, and many others. And so that's why I'm honored to be here today, and I really want to take a few moments to acknowledge those who've made this possible. First of all, Mayor Staggs is a visionary leader, tremendous energy. Riverton is so fortunate to have him at the helm here. And those who make government work along with him, council, commission, and everyone else here at Riverton. Thank you for stepping up, Mayor. Thank you for not waiting for an invitation to do something and being proactive and putting Riverton right at the top of the list of those making a difference. I want to thank our partners at IHC also, and IHC, my good friend Dr. Mark Harrison and his team, they've done an incredible job in many facets, particularly with incentivizing their physicians to prescribe less and supporting opportunities like this to take back drugs out of our homes, to neutralize them. So thank you. Please take back our appreciation to everyone on the team from the state of Utah. Certainly, the business community and innovators like NarcX, they're leading the charge in many ways. Government cannot do this. Government should stay lean and help be a part of the solution and maybe a perimeter, but it really will take the private sector, it'll take NGOs, it'll take academics, and it'll take you, good citizens of Riverton, the state of Utah, to really all come together. Because truly, that's a critical message. We are all vulnerable. This affects everyone. It doesn't discriminate. It doesn't care your background, your age, your gender, your orientation. It will kill anyone indiscriminately. And so we need everyone pulling together. I want to thank the law enforcement and first responder partners that we have. None better in all the country. Like Agent Besser, I've had the privilege to travel around, train, work with, and I'm so proud to say that I'm from Utah. I get to work with these fine gentlemen, men and women that they lead and represent. Last but not least, I do want to say a word about my partner in fighting crime, Brian Besser, DEA District Agent in Charge. I love my federal partners in law enforcement, but I have never, ever worked with one like this. From the moment that he arrived 2.5, almost 3 years ago in Utah, he's been an energizing buddy, and we've not been able to turn him off. He and I together have traveled and individually between us every nook and cranny of the state, trying to awaken people to the threat that is alive in our own midst, in our backyards. And it's his vision and his determination and his compassion and passion for this issue. I want that has really helped Utah rise to the top. I want to mention something. I was just in Washington, D.C. on Monday. Some of you might have seen me at a large press conference related to a different issue, but also to talk about a huge potential settlement with opioid manufacturing. But my point is, as I was there, Republican congressional leadership, Democrat congressional leadership, and the White House all thanked me for the work that Utah is doing to lead out and be an example. And it's because of municipalities, cities like Riverton, and their example that Utah's being held up as a standard. And it's because of agents like Brian Besser. Brian, can you just, this is the one statistic that I do want to share. How many tons of weed taken back through the DEA Take Back program. Step back up for just a second, because that's, I think, so important for people to grasp. And you guys have tripled that number. If you'll indulge me for a moment.
Thank you. It's been a collective effort. 3 years ago, if we broke, say, 3,000 pounds across the state, again, of unwanted, expired, unused prescription medication, that was a big deal. In the last 3 years alone, we've collected, and just using 2 days, one in April and one in October, but just in the last 3 years alone, we've collected 90,000 pounds. So that's on average about 17,000 pounds of take-back event. And that's just with the commitment we have from the community. Okay? A lot of people don't know it exists. Some people just are impartial to it and don't care. But as the word gets out, we're starting to ramp up. Again, I'm thankful for the mayor, because now this is getting out, that this exists. And then this is what we do with our medication. We don't throw it down the toilet, we don't burn it, we don't throw it in the garbage. We get rid of it safely, and we save lives in doing that. But I'm proud to say it's a collective effort. The idea of ramping these things up, Sean was so right. Inadvertently, many individuals have no idea that their kids are sifting through grandma and grandpa's medicine cabinet, maybe after surgery. Quick anecdotal example, let me indulge the crowd on this. I've traveled around the state for the last 3 years, spoken in a lot of schools, businesses, faith-based institutions. I'll tell you one story that has come up numerous times, this should hit home. A lady came up to me once and she said, answer the door. And another lady came up to the door, and I hadn't seen her in a while. She goes to my church and she had a plate of cookies in her hand. And she said the conversation was kind of cursory, a little shallow at the front, we hadn't seen each other for a while, kind of was wondering why she was there. And we just talked, about the weather, about the kids, over a plate of cookies. And in about 5 minutes into that conversation, the lady stopped me abruptly and she says, can I use your bathroom? And the whole purpose was she was traveling from door to door to get into people's medicine cabinets because she was struggling with addiction. And I've heard that story time and time again in different areas, in different flavors, and different nuances. So it is extremely important for us to get rid of these and not enable people and to continue to save lives.
Absolutely. Thanks, Agent Besser. The majority of crimes I think my law enforcement partners deal with at a local level derive from substance use disorder. That's what's generating that. And one other thing that I want to mention, something that we focused on a lot as we dealt with youth and communities, is that we need to eliminate shame and judgment in this discussion about opioids, whether we're talking about manufacturers, treatment, or in this case, diversion, removing the threat in a safe way thanks to NarcX. But we need to remove judgment and shame because far too many people are suffering and too afraid to come forward. Their families are not willing to come forward because they're concerned about what people will say, what people will think. And that needs to change. It is changing, and we've seen a lot of progress. We need to stay connected as communities because the antidote to what drives a lot of the addiction is loneliness. The antidote is connection, and the antidote to loneliness. There's a lot of loneliness. There's a lot of isolation, mental, behavioral health challenges that ends up fueling addiction. People are in pain, and they self-medicate and end up down the road. As was referenced earlier, many of them inadvertently, because of prescription drugs, end up down a dark path that they would have never guessed. And it's really up to us to step up together as a community and work together. I want to leave one final thought. The State Opioid Task Force has worked to change policies, to pass better laws, to get better data, to help the treatment and recovery community, to help educate, to push back against manufacturers, get better prescriptions. We have pharmacies self-regulating, pushing to make sure insurance companies fund even more. The State Opioid Task Force has done all of that. People every day ask me, what can I do? What can I do to make a difference? You may not be able to arrest someone like the DEA just did, taking down one of the largest global fentanyl illicit mills in amazing fashion. You may not be able to do that. You may not be able to change physician prescribing policy. But ladies and gentlemen, every single one of us can make a difference starting today, right now, by going home and getting rid of some of that unused, unneeded, expired medication in a safe, environmentally safe, and public health safe manner. And I encourage you to please do that. State Opioid Task Force has helped produce a program here in Utah called Addiction Unplugged on A&E. I think I've heard that it's moved up to become A&E's #2 show in its first season behind Live PD. I encourage you to take a look at that as it addresses some of the more comprehensive issues regarding addiction. You can access the first episodes if you have cable television on demand. But as you watch some of those programs, think about what each and every one of you can do. And remember, today is the day to make a difference. Let's take back as many of these drugs out of our cabinets, out of our homes, and put them away. No loaded guns in the presence of our children or our families. Thank you, and God bless you. This wonderful city of Riverton, the great state of Utah. God bless America. Thanks a lot for all of our partners in Mayor particularly. Thank you today.
Thank you. I'd like to invite everybody to just step a little bit closer and just give everybody a round of applause. And thank you so much for all of you. We're going to take a few questions. Before we do that, I'd like to just describe what Riverton City will be doing, where these boxes will be located. We're going to attempt to really distribute this out throughout the community, engage in education, information. But these kiosks, particularly at Riverton City Hall, at the police department, at our Riverton City Public Works Department, and our fire stations here in Riverton, and our police vehicles will also be able to take with them these gallon-sized containers that you see. And as Intermountain Healthcare has indicated, they have 1,000 of these individual-sized bottles that we can have. So it really is time for action. It's going to require everybody's effort, and so grateful again for everybody that's part of our city, our elected, all of our elected officials, our council, and our staff, our support, our law enforcement, and our first responders, and our great community partners such as Intermountain Healthcare, and of course the state and the opioid task force.